Hello, my name is Brianna, and today I'll be talking about a contemporary nursing topic that I've chosen, which relates to both patient safety and a healthy work environment. So the topic that I've chosen is bullying in the nursing profession, specifically bullying amongst nurses on the same organisational level, which is known as horizontal bullying. Within this presentation, the following will be addressed: background of bullying and what it can entail, the impact of bullying on nurses, patient safety and a healthy work environment, significance of bullying to contemporary nursing practice, what is being done about the issue, how effective leadership can mitigate or resolve the issue, and responsibilities as a new graduate nurse in relation to horizontal bullying in nursing, including ethical and legal boundaries. So what is bullying defined as? Safe Work Australia defines bullying as unreasonable behaviour towards a worker or group of workers that is repeated and poses a risk to health and safety. It was discovered through research findings that this inappropriate behaviour can be direct or indirect, verbal or physical, and undermines the bullied individual's right to dignity in the workplace. Bullying behaviours exhibited between nurses range from overt behaviours that are more easily recognised and observed to more covert or subtle behaviours. Overt bullying behaviours include yelling, physical confrontation, humiliating, threatening and intimidating conduct, eye-rolling, and using an aggressive or abusive tone or language when speaking to others, just to name a few examples. More subtle bullying behaviours that are more difficult to recognise include withholding information vital to your work, assigning workloads and timelines that are unfair or unreasonable, excluding people deliberately, encouragement of bullying behaviours, spreading rumours, and unjustified criticism of others publicly. So how does horizontal bullying within nursing relate to patient safety and a healthy workplace? Well, the issue poses a risk to patient safety and it impedes a healthy workplace. So I'll now discuss reasons why this is the case, which were gathered from multiple sources of literature. Firstly, research has found that bullying amongst nurses can have a negative impact on the bullied individual's physical and mental health and well-being. For example, literature highlighted that nurses who experience horizontal bullying in the workplace may face lowered self-esteem, depression, anxiety, and stress. In turn, the emotional distress caused by being bullied has been shown to impact negatively on work performance and thus impacts on the ability to provide safe care of high quality to patients. Therefore, horizontal bullying in nursing does not just affect the victim, it also has a negative impact on patients and their safety. Incidences of nurse bullying can also lead to a negative workplace culture, which prevents a healthy work environment where nurses can thrive. The emotional distress caused by working in this kind of environment can lead to nurses' increased experience of job dissatisfaction, increased time off work, decreased productivity, and lower morale and motivation. Nurse-to-nurse bullying can also lead to ineffective teamwork and negatively impacts professional relationships, which are integral to ensuring a healthy workplace and provision of safe care. It's also been found that bullying amongst nurses disrupts effective communication. This can have impacts such as hindering the sharing of essential information regarding patients between nursing staff, which can compromise patient safety. Furthermore, the ineffective communication that results from bullying leads to an unhealthy work culture where rifts between employees exist and collaboration decreases, which further contributes to weakened employee performance and poses greater risk to patient safety. So what is the significance of horizontal bullying to contemporary nursing practice? The topic of horizontal bullying in the nursing profession is an issue that has been prevalent for many years, and recently there's been increased reports of bullying in the workplace. The negative outcomes of bullying are significant, and they've been shown to be correlated with nurses leaving the workplace. Horizontal bullying in nursing has negative consequences not only for victims, but also patients, other staff, and effectively the entire organisation, as lower productivity caused by bullying incurs financial costs. Within Australia, as per registered nurse standards for practice, it's a standard of contemporary nursing practice to engage in therapeutic and professional relationships, not just with patients, but also with staff. Bullying in the nursing profession impedes professional collaboration and communication between colleagues, which prevents this standard, an integral aspect of nursing, from being adhered to. As well as this, the Code of Ethics for Nurses in Australia highlights that contemporary nursing practice also values a culture of safety in nursing, as well as respect and kindness for others. Bullying creates an unhealthy work environment where victims are not treated with respect and kindness. Therefore, it can be seen that the issue of bullying amongst nurses in the workplace is significant, as it opposes these important standards and values embedded within contemporary nursing practice. So what is currently being done about horizontal bullying? Well, at present time, policies are in place to guide employees and employers about steps involved to minimise the risk of bullying and how incidences of bullying can be handled. For example, within New South Wales, the policy Prevention and Management of Workplace Bullying in New South Wales Health is in place to provide guidelines for prevention and management of bullying in the workplace. Additionally, education and training on the issue has been put in place. For example, within New South Wales, HEDI Health Education and Training provides online courses such as workplace discrimination, harassment and bullying for employees, which provides information on what constitutes workplace bullying, expectations and roles in the handling of bullying, and how to report bullying within the workplace. Legislation is also in place to combat the issue. For example, bullying is prohibited by the Fair Work Act 2009. So how can effective leadership contribute to resolving or mitigating horizontal bullying? Nurse leaders can change workplace culture and contribute to the prevention and elimination of horizontal bullying through leading by example and modelling professional, respectful behaviour, effective conflict resolution skills, and through modelling zero tolerance to bullying. Nurses can model zero tolerance to bullying through showing moral courage and confronting culprits of bullying. Nurse leaders can also provide support and education to others about what constitutes bullying, how to recognise bullying behaviours, and how to respond. Effective leadership where nurse leaders develop strong relationships with other colleagues, acknowledge others' efforts, and create opportunities for staff to collaborate are integral to a healthy work environment where staff feel more supported. This is necessary for staff to be able to perform better. Participation in creation and changes to policy and legislation that's targeted towards elimination of bullying is another way effective leadership can mitigate bullying. Nurse leaders can also ensure the resources necessary to combat workplace bullying are available through working with all sectors, including policymakers, hospitals, and physicians. So what are your responsibilities as a new graduate nurse in relation to horizontal bullying in nursing? Well, all nurses, including new graduate nurses, are responsible for maintaining a positive work environment free from bullying. The Code of Conduct for Nurses in Australia states that nurses must never partake in, ignore, or excuse bullying, and that they must act to eliminate all forms of bullying and escalate any concerns. Therefore, an important responsibility of a new graduate nurse is to adhere to the Code of Conduct for Nurses in Australia by exhibiting professional behaviour and advocating for a workplace free from bullying. This means that as a new graduate nurse, if bullying is witnessed, it should not be ignored. It should be addressed in a calm manner with the person exhibiting bullying behaviours, or it should be reported to an appropriate person within the workplace, such as the manager. New South Wales Health advises that information on making a bullying complaint can also be sought from workplace intranets, the anti-bullying advice line, or via human resources staff within the workplace. Another responsibility of a new graduate nurse is to uphold the values of the nursing profession as stated in the Code of Ethics for Nurses in Australia. The Code states that the development of supportive and constructive relationships, as well as respect and kindness for others, is valued. Therefore, new graduate nurses are responsible for ensuring they are kind, respectful, and supportive of others. Nurses should also be aware of their workplace's policy on bullying. It is within their scope of practice to be able to access and adhere to their workplace policy. Through being familiar with the relevant policy, nurses can be informed on what to do if they have personally experienced workplace bullying, or if they are aware of another colleague being bullied, they can be aware of how to provide the person with support. It's also within a new graduate's nurse's scope of practice to privately document any incidents of bullying, as this will help if a complaint needs to be made. If a new graduate nurse feels safe and comfortable, they can also approach the bully and communicate in a calm manner that their behaviour is unacceptable and explain to them how it makes them feel. The bully may not realise their behaviour has affected others in a negative way, so by giving them feedback, the bully has an opportunity to stop their behaviours. New graduate nurses, like nurses of all levels of experience, also have the responsibility to engage in continuing professional development and training. Therefore, any education and training regarding the concept of bullying in the workplace and how to prevent it should be undertaken. In relation to responsibilities as a new graduate nurse, there are legal and ethical boundaries to consider. So as per New South Wales Health Policy, all staff members have the right to confidentiality and the responsibility to have private matters kept confidential. This applies to when a complaint is made regarding bullying within the workplace. This means that complaints of bullying should not be discussed with those who aren't involved in the complaints process. Therefore, as a new graduate nurse, if you report an incident of bullying, it's against policy to gossip to others not related to the matter. It may also be deemed unethical, according to the Code of Ethics, to unnecessarily spread information about bullying incidences, as nurses value the ethical management of information. So how has research and policy been used to support my presentation? Well, to ensure high-quality research was used, information was taken only from peer-reviewed research articles, which were written in the last 5 to 10 years. Systematic reviews were utilised as they reviewed multiple studies in a systematic and rigorous way. Therefore, the research used is of high quality to best support evidence-based practice, which is important in the nursing profession for making decisions that best uphold patient safety. The policy Prevention and Management of Workplace Bullying in New South Wales Health was used as it is relevant to the topic being discussed and provides information on steps healthcare facilities within New South Wales should take to prevent and manage bullying. By undertaking this presentation, effective leadership has been exhibited through taking initiative to advocate against bullying and educate others. Information has been conveyed via a narrated PowerPoint to target multiple sensory modes. For example, images and fonts are used to target visual senses, whilst information is also written and provided through auditory means. It was found that by using both words and pictures, rather than just words, viewers' attention is easier to maintain and information is easier to comprehend, which aids with learning. By using different modes of providing information and targeting visual and auditory senses with this presentation, specific cognitive and perceptual strengths of different people can be met to aid their learning. So that's why I've chosen to present it in a narrated PowerPoint. So thank you for listening to my presentation. I hope you enjoyed it.